Welcome, listeners. My name is Dr. Ronda Marie Chakolis. I am very excited to be here. And I have to let you know that the views and opinions on this show do not represent any of my employers or affiliates. Ladies and gentlemen, it is an honor and privilege to be sitting next to somebody who I've admired um, pretty much my whole pharmaceutical career, Dr. Pernessa C. Thank you so much for being here, and I'm going to let you introduce yourself.
Ah, it is a joy. It's a joy for me to be here with you. I am indeed Pernessa Seal, and I am today, I am the founder and the CEO of the Balm in Gilead. And the
Yes.
Balm in Gilead, we are excited to be here in Minneapolis this weekend.
All right. Thank you so much. So, my first question is, tell me a little bit about your background and your educational experience.
Oh my goodness, that'll take up the whole program.
Yeah. We'll just keep it short. I know you've done so many things, but we'll just keep it
Oh,
short.
well, I tell you, God is so good. Um, 36 years ago, I had a little idea. I was a research scientist in immunology and in New York, and got this job at Harlem Hospital. I was in transition because I had gotten tired of being in science after wasting my mama's money going. And the AIDS epidemic it was a mess. It was a
Mhm.
mess, and people were dying. The whole Harlem Hospital was just filled. All the beds were filled with people who were at that time dying of HIV and AIDS. And I really didn't understand why pastors and church people and mamas and daddies were not coming to sit by the bedside of their loved ones. And I just got a crazy idea to do the Harlem Week of Prayer for the Healing of AIDS. That was the idea. A Harlem Week of Prayer for the Healing of AIDS, mobilizing the faith community, Christians, Muslims, Ethiopian, Hebrews, Yorubas, all of them, to come and pray and get educated about HIV and AIDS. And lo and behold, that little idea gave birth to the Balm in Gilead. And today we are an international organization having worked in 6 African countries with headquarters. We have a small headquarters in Dar es Salaam, Tanzania, and our national headquarters is in Richmond, Virginia.
Wonderful, wonderful. So, a little bit about me. I've been very interested in HIV and AIDS starting in the early 2000s. What I saw was a phenomenon that we weren't talking about in the church, where a lot of women, Black women in particular, were getting HIV,
That's
and we
right.
didn't talk about it. While I was in pharmacy school, my ideal was to do my paper, my like dissertation that we had to do at the time on some of the barriers for women, African American women in particular, for getting care or prevention for HIV and AIDS. And in 2008, I had a professor who told me they would not sign off on that paper
Mm.
for me to pursue that topic because it didn't merit scientific discussion. And even from an academic and the church perspective, right, we've had those barriers that we've had to overcome to get people to notice this topic. Tell me some of the barriers that you encounter because you make it seem like this was so seamless to even have people one acknowledge that this existed, and two, like, how did you actually put it into practice?
Well, that's a great question. I have to go back a bit, and I get that question a lot. You know, it's really we weren't. This is in 1989, and in 1989 we were not talking about cultural competence. That was not a word at that time. It's a big word now. But really, when I look back, the Harlem Week of Prayer for the Healing of AIDS, it really was a cultural competence intervention. Working at Harlem Hospital, I went, because I had this little idea like 3 days into my new job. And my bosses, because I had a whole bunch of bosses, Dr. Wafa El Sada, who is an international known, she was my boss. They were like, "Okay, you want to do HIV in the church? Go ahead, go ahead. We've tried that. We've tried that." And of course I'm crazy because I'm from a little black town in South Carolina. And we were taught how to, when the Lord speaks to you, you got
Yes,
to
ma'am.
move, right? And so I went out and knocked on doors. It was just me. I had no money. I had nothing. knocked on doors, and my first pastor was Reverend Dr. Preston Washington, Memorial Baptist Church, and I stood in line after he preached that. I stood in line to shake his hand for an hour. And when I got up to him, I said, "Hi, Dr. Washington. I'm Pernessa C, and we are having a Harlem week of prayer for the healing of AIDS." We was me and the Lord, you know. But to your point, um, people had gone. They had worked, tried to go get the church to open up, but they went with a condom and a banana.
Mhm.
I went with the prayer, Harlem week of prayer for the healing of AIDS. And my thing was that you can, Pastor, you can't tell me that you can't pray.
Yes, ma'am.
I wasn't talking about their positions. I wasn't talking about where they were in their spirit world around HIV. I met them where they were in prayer, and you can't tell me you can't pray. And I would leave some information there. So, some pastors would pick it up and read it. Others was like, mm-mm, we don't even want to touch the brochure. Well, on that Sunday, in the week of prayer, and the pastor got up and said, "We're going to now pray for HIV." Well, guess what happened? The parishioners came and said, "Pastor, thank you for the prayer. I have HIV.
Mm.
Pastor, thank you for the prayer. My son has it. My son has died." It opened up the floodgate because the pastor had said it from the pulpit. And then he goes back and get that brochure I left because he had no idea that there was so much HIV in his congregation because he had been silent on the issue. So the week of prayer for the healing of AIDS opened up the floodgates for people for them to actually see how much HIV was actually in their congregation. I remember the great Reverend Dr. Wyatt T. Walker on that first Sunday. He stood up and he said, I have already buried over 70 men from my congregation. Because now with prayer and now there's a movement, pastors are beginning to come out and say how they're really dealing with this HIV. I didn't tell them it was a opening of letting them find their own voice in their own search, in their own relationship with God. They had to come to a place where they could talk about it.
Right. Fascinating because I know you're a scientist too, right? And
Mm-hmm.
I think about a lot of times how I was trained, right? We're not necessarily allowed to maybe um, talk about our faith, right? Some people think if we go with our faith, we're not trusting the science. If we go with our faith, then we're not, vice versa. And so, what are some of the things like I noticed you said you meet people where they're at
Mm-hmm.
without judgment? You see people as people. What are some of the things that has allowed you to be a testimony to other scientists to use the church or the faith and see people?
Well, going back to those Harlem days, as I mentioned, my boss was who is now a renowned global scientist, Waf El Sada, and I said, Dr. El Sada, let me prove something to you.
Mm-hmm.
I'm going to take that brochure that you have in the clinic that nobody touches, and I'm going to take that same brochure and put it in the church. And I'm willing to bet you people are going to take that brochure from the church. And guess what? They did. And so that proved my point that for us, for African Americans, our greatest influential body is the
Mm-hmm.
church. If you get information from the church, the pastor has sanctioned it. I got this from my pastor. So it's something I need to really, really look at and observe. This is important because I got it from my church. I got it from and then we realize when you get it from your church, you're going to pass it on. You're going to take it to the people who don't go to church. You know what I mean? So it's very important that when we're working in community, that we understand the community that we're working in. So where science and faith um, connected. At the Balm and Gilead, our slogan is, "We are where public health and faith connect,
Mm.
because the two most important people in a person's life is the pastor and the preacher. The pastor and the doctor.
Yes.
The pastor and the doctor, so we lift that up. We are where public health and faith connect. So every work that we do, every conference that we put on, it's about bringing public health and faith together, because in our lives, in our world, there is no difference. The Balm and Gilead, we look like church, but we're actually a public health organization.
And that brings me to my next question, right? How do you select partners when you're out there doing this work, right? Because sometimes, I've heard that the church can be difficult, or, this pastor, they don't want anybody from the outside coming in. How do you select partners and how do you move your work
Well,
forward?
it's like sometimes the church partners with us. They contact us, and sometimes we contact them.
Mm-hmm.
But we meet them where they are. Sometimes it's the pastor who wants us to come and have the conversation that he doesn't feel he can yet.
Mm-hmm.
Sometimes it's the pastor's wife. Sometimes it's the missionary. Sometimes it's the deacon,
Mm-hmm.
because every church is a culture unto itself.
Right.
So sometimes if you go to the pastor, you might find a barrier. But if you go to the first lady, or if you go to the head of the missionary department, you might get in through that vein. So it's really about really understanding, who the culture, if you will, the culture of that church. But we also know that the leader of the church is the pastor. Let's be
Right.
clear about that.
Right.
Even though you may get into the congregation through the missionary supervisor, or the head of the choir director, or even the head of the transportation department, you just don't know. Hey, you got to bring this to my church. The head of the church is the pastor.
Right. And it sounds like you have to do a lot of relationship building. Um, how did you develop those skills? Because a lot of times when we're in school or whatever, we have our treatment algorithms, you have your check boxes, you have your protocols. How did you develop those skills to build relationships?
Well, I don't think I developed them. I think it's just who I am. It's who I am. I'm from a all black town called Lincolnville, South Carolina, and my aunt Hattie was the person who fed the pastor every second and fourth Sunday. His name was Reverend Funny, and he was the pastor of Good Hope Baptist
All
Church in
righty.
Greeleyville, South
All
Carolina.
righty.
And when I look back, I learned so much from sitting in, because the kids couldn't eat until the pastor ate. The Uncle William had to eat. Everybody had to eat before we got the crumbs for real. you know. My mother, who was a school teacher, she was not one who fed the pastor every second and fourth Sunday, but she would have the pastor over for dinner. Maybe once every 2 or 3 months. And so on those, when the pastor was coming, I had to clean the silver. I had to,
Oh,
because I'm an only child, I had to clean, 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 and clean. And I remember one Sunday afternoon, and I will never forget this. The pastor had left. The pastor smoked cigarettes, but he was smoking on the down low, if you will. And my mother smoked cigarettes. And when the pastor left, my mother took out a cigarette and started smoking. And in that, there was a conversation in that she did not want the pastor to see her smoking cigarettes. Well, I was like, well, Mama, why? He smoked cigarettes. And and that stayed with me,
mm-hmm.
and I can always pull it up, because it was a moment, in that moment, that both people did the same thing, but they didn't want each other to see them doing
Mm-hmm.
it.
Right.
And I think that that's a part of one of our public health challenges today, whether it's HIV, or cancer, or lupus, or whatever. It's that yeah, I'm doing it, you doing it, but we're not going to talk about it.
Right.
I'm not going to let you see. I'm going to hide. And here are two leaders. And he's been in my home, and he's sitting, and he's, being revered as a pastor. And my mother was, of course, a leader as a school teacher, and she was Miss All That. But there was a silence. They both smoked cigarettes, but
Mm-hmm.
neither one of them wanted each other to know they smoked.
And that's what our community does, right? We don't want each other to know we have diabetes or
That's
we're
right.
struggling with mental health
That
or hypertension. And so I love that your focus was on HIV. Tell me some of the other initiatives that the Balm and Gilead has focused on.
Whew, today we are busting out at the seams. I would say maybe about maybe 10 years, no, about 11 years ago. Um we I decided that I decided that we were going to push and broaden our conversation from HIV to look at other diseases, because we also knew that some folks in the church were having issues because we were spending so much time talking about HIV and not diabetes or not
Right.
cancer or whatever. And we started an initiative, Healthy Churches 2030 conference. It was Healthy Churches 2020 conference, looking at healthy people,
Mhm.
healthy human services. That's their one of their programs. Every
Mhm.
decade, they look at how we're going to get better during this decade. So we launched Healthy Churches 2020 conference.
Mhm.
And at that time, I was, running around trying to get every church to start a health ministry. I was averaging 8 runways a week,
Wow.
and I was like, you know what? Let's start a conference where we bring everybody to us, because I'm getting worn out.
Mhm.
And that conference opened up today. We'll be doing our 11th annual Healthy Churches 2030 conference now in November. So the roadmap, and while we're in Minneapolis, it's to we're on our way to Healthy Churches. And this conference works with, we look at multiple myeloma. Multiple myeloma is African Americans have a higher rate of multiple myeloma, and we don't get diagnosed until in our 50s and 60s. We are involved with genetic kidney disease. If you look at dialysis. All the black people in the dialysis room, but we're not told about. We need to go and get genetic testing. We're not even
Yes.
offered.
Yes.
We're not even offered it. And then there's peripheral artery disease. We black people, we still have the highest rates of amputation in the country. This is ridiculous.
Mm.
You don't have to get your legs and feet and toes amputated. But guess what? We don't get diagnosed until we have the amputation. We are not told. My mother had both of her legs amputated, and I didn't not hear anything about peripheral artery disease until about 5 years ago. Now that's me. My goodness. And so we address Alzheimer's and dementia and everything. We do community gardens. We're talking about just mental health.
Right.
The Balm and Gilead, we have broadened our scope, and we continue to broaden our scope to educate our people on prevention as well as treatment,
Right.
because so many of us have crossed into treatment, and we go to the doctor. And I'm telling people now, if the doctor tells you, yeah, I see something, but we're going to wait, you get up and go find yourself another doctor,
That's right.
because oftentimes we just going to watch it. No, we ain't. We ain't gonna just watch it anymore, because you could prevent me from getting the stage 4.
Right.
You know what I mean? But you decide you're gonna watch it. And we have to educate our folks on what to ask, the questions to ask about when you go to the doctor, because oftentimes we're not offered the latest and the greatest intervention.
Right.
We're given the same pill that they've been given since 1990, not the latest and greatest that FDA approved yesterday.
Right.
And it really, I get really annoyed when I just think about just the inequity, that we have to deal with every day in healthcare, because we're just not given the information. So we want to prevent, but we also want to educate our folks around what if you have these diseases. Let's get some information about them, know what to ask for, know
Right.
what the latest and greatest treatment is, diagnosis is, genetic testing is important. Let's get in clinical trials. There's a new drug out, the new Alzheimer's drug. We're
Right.
excited about it. But guess what? Only 1% of African Americans was in the clinical study. What does that say? So that says, well, it might work for us and it might not. You know what I
Right.
mean? We have got to get black folks in clinical trials. And it's not just on us to get black folks in clinical trials, it's about changing industry as well.
Right.
So the Balm and Gilead, we sit in those rooms where we're fighting industry, you know what I mean, that, it's not, the ownership is not just for us to get black people in clinical trials. It's the ownership is on you, industry, to make it accessible to as well. So we're fighting the fight on all fronts.
You are. And I love that you're talking about genetic testing because, as you know, I'm a pharmacist. And one thing we know now is there's tests out there that can really tell you, it's like $150 that can tell you how you metabolize drugs.
That's right.
And so we no longer have to try 6 or 7 different drugs. We actually could get a 6-page report to go in there and say, hey, is this antidepressant even going to work for me?
How about
Is
that?
that blood pressure medicine going to work for me? And you can carry that information and ask for it. Minnesota is a state actually that does pay for biomarker testing,
Mm,
but it's not offered. Our state funded insurance programs actually pay for that. So imagine if people actually took that information and one trusted that it was going to work,
that's right.
how powerful that would be. Because when I'm out in practice, I tell people race no longer has anything to do with a driver of health.
Mm-hmm.
It really is how our body metabolizes
Mm-hmm.
things. It's really that patient or
That's right.
person centered experience.
That's
And
right.
so I am so excited that you're out there and you're passionate and you're educating our community and not empowering, because again, for me, that word means that I'm giving you something that you don't have. What
Mm-hmm.
I want people to know is we have the power, but through these platforms, we're building capacity
Right.
and we have the ability to change the world that we want to see.
That's right.
So when you're in there fighting, one thing that I've learned is I don't always see myself um, in these arenas or these spaces, right? You walk in a room, you don't see anybody that looks like you. You don't see anybody who was trained like you or connected with your faith. What are some words of advice that you have for young people who are watching you now? And when I say young, young in their profession, maybe young age wise, what are some advice that you have that how you can get in those rooms and where you know you're not alone, right?
Well, you get in those rooms by one putting one foot in front of each other.
Mm-hmm.
It doesn't happen overnight,
Mm-hmm.
you know. But what's important, what you do is when you get in the room.
Right.
When you get in the room, so a young woman at South Carolina State, I spoke there a couple of months ago, and she came and she said, "What's that? What?" She was so excited, and she was in science, and she said, "What is the one advice that would you tell me?" And I said, "Tell the truth.
Right.
Tell the truth." We when we get in those rooms, we have a responsibility to tell the truth.
Mm.
We have a responsibility to educate those others who may not look like us, because guess what? They don't know. They don't always know, and if they know, they we don't know what's in their head.
Right.
They may be a friend or a foe. We don't
Mm-hmm.
care. We're going to tell the truth.
Mm-hmm.
We're going to always advocate for black and brown, and everyone advocate for everybody. I
Right.
was in a clinical trial meeting just I don't know, could have been yesterday, but I think it was 2 weeks ago. And this clinical program that Balm and Gilead is launching is about getting African Americans in clinical trials. And I'm
Mm-hmm.
talking to industry. Well, you got to do your part. And then they went to, well, we have to make these clinical trials open for everybody. I'm like, wait a minute. Hold up. You talking to me because you want more African Americans.
Right.
We have got to, FDA, so we have got to get more African Americans in clinical trials.
Mm-hmm.
Correct?
Right.
Correct. Okay, so now why are we talking about getting everybody in it when we know that we have a mandate to get African Americans and we have the facts? So sometimes, even because I've worked with the Centers for Disease Control,
Right.
and legislation says one thing, but by the time you write the legislation and by the time it gets activated in the community, it's a whole nother thing.
Right.
And the legislation was written for black and brown people. Guess what? The last people who are getting it is black and brown people.
Right.
So we have to always be ready to tell the truth and to
Mm-hmm.
speak truth to power, because you may not get invited back, but when you left, everybody know you were there. And the second thing that's important to me is that I'm just so blessed that I have a group of individuals, young up and coming stars that I have, and I pour everything that I know into them. You
Mm-hmm.
know that because I don't feel like being on 8 planes a day. You know what I mean? Run 8 runways. 3 and 4 times in Africa. That my no, we don't want to do that again.
Right.
But the fight is still on, and we have to be conscious about making sure that we are empowering and teaching and pushing the next generation of leaders who are going to speak truth to power when they get in
Right.
those rooms. That's so important because we're not going to, Harriet Tubman did her thing, but there was a whole lot of work that came after Harriet
Yes,
Tubman, and we're
ma'am.
doing our thing, but there's a whole lot of work that still has to come behind us. And so we have to always consciously, intentionally build up the next generation of leaders who are going to walk in that room with authority, with fact, and speak to the room, regardless of who's in the room.
Right.
Because when we get in there, we represent everybody.
That I love it. I love it. I love it. And again, that's what you're saying, that intentionality. So that relationship building, not only with people in the industry, but up and coming people.
That's right.
Again, it's a lot of work you're doing. I'm sitting next to you. I'm feeling energized. But also, one thing that I've seen is people who do this work, who are advocates or whatever, sometimes they don't do a good job of taking care of
Let's
themselves.
see. Now you're getting messy. Now you're getting messy.
I'm getting messy. I'm gonna get messy because I know a lot of times we can do better. I know my mom was very active in the community, and I watched over the years how diabetes
Mm-hmm.
robbed my mom of
Mm-hmm.
her potential. And even in our community, where back in the day, I remember like dialysis was something we didn't do, right?
Mm-mm.
We didn't ever get to dialysis. And then now our community started normalizing that. Then, like you said, we started normalizing amputations,
Mm-hmm.
right? Now we're talking about dementia and cognitive impairment because how I was raised is it doesn't matter. You're not going to have legs or toes, but you're going to have your mind intact.
Mm-hmm.
Well, that's not no longer the case.
Mm-hmm.
Back to my question, how do you take care of you?
Well, that's a loaded question.
Mm-hmm.
So, I'm in a very interesting place in my life. This my I call these my latter days will be my greater days.
Right.
And I've taken on a whole new work in South Carolina with preservation, and I'm still the bomb in Gilead is I'm gonna always be the bomb in Gilead.
Right.
Those leaders I talked about are so important.
Mm-hmm.
I don't have to run like I used to run, and it's exciting. It's exciting to see them grow and come into their own. Um, it's exciting to even when I'm bumping heads with them, you know what I mean, and having to step back, and it reminds me of the leaders who I had to bump heads with, who had to
Right.
be patient with me, who gave me opportunity even when I didn't think I was ready, and even when I was cocky and thought I was ready,
Mm-hmm.
and they were able to sit me down, but I never wasn't really good at sitting down, but uh, so I have a phenomenal team of folks
Mm-hmm.
around me. I
Mm-hmm.
mean, they are just the Balm and Gilead have an A+ team, and
Mm-hmm.
that's important to build a team who can take on some of this work. The other thing is I have a little puppy dog. His name is Trey, and Trey thinks he's a person,
Okay.
and he insists that I walk him every morning and every night and every evening. And he's not the dog that I can just take outside and okay, Trey, we outside, go do your thing. Mm-mm. He pulls me. I have to actually walk.
Mm-hmm.
Whether I feel like it or not, I have to. He insists, so he's a part of my health plan.
Okay.
Walking my dog, and the other thing that's important is that I have been in 1985 was the last time I ate red meat.
Mm-hmm.
When I got to New York, I got on this health kick, and that was probably one of the health kick, meditation, metaphysics, all of that 30 40 years ago really helped shape who I am
Mm-hmm.
today. I have always been I'm not I've always lived with obesity. I was an obese child, and a matter of fact, being back home, now in Lincolnville, I look at all those. We are now aged, and they used to call me Fatso or Pokey Pig every single day.
Mm.
So I can see why I got mental health issues because you mess with. I'm just joking
Right.
with the
Right.
mental
No,
health,
but body
but
image
the
is
trauma,
true.
the
Right.
trauma around being a fat child, if you will.
Mm-hmm.
And if a fat child back then was a healthy child,
Right.
you know what I mean. The fatter you were was a healthy child.
Right.
So you know, I know it's a genetic factor, but at the same time, it's a genetic factor. It cannot be an excuse.
Right.
So it's all of those, how do I take care of myself? It's all of those truths that I have to constantly tell myself. I have to constantly think about drinking water.
Mm-hmm.
You know what I mean? I'm drinking water is not my thing, but I have to constantly drink water. When my
Mm-hmm.
legs begin to hurt, before I reach for go to the doctor, drink some water. You need to drink some water.
Right.
You know what I mean? And I found that drinking water helps so many issues that you think something's wrong with you. No, you just dehydrated.
Right.
You
Right. And that's why your skin looks so good as I'm sitting here. It must be that water that's keeping that skin popping.
Yeah,
Yeah.
it's
Mm-hmm.
it's also becoming, as you grow older, is becoming mindful of
Mm-hmm.
who you are today, and the road behind really instructs you
Mm-hmm.
on where you are. I don't have diabetes or hypertension or all of that. I just got obesity and arthritis.
Mm-hmm.
You know what I mean? And I find that drinking a lot of water helps my arthritis.
Right.
So that's how I take care of myself. I have my team, and my team is always telling me to get rest. They're always, are you resting? And I, matter of fact, they before we have a meeting, they're gonna start fussing. I'm like, can you not fuss today? Can we just go into the meeting, please?
Yes.
So having a team around is very important. Having my little puppy dog around, but most important, being mindful and intentionality about my own health is very, very important because I'm doing a lot. And the other thing I'll say before I be quiet is sleep.
Okay.
Sleep is a factor,
Mm-hmm.
and I that's one thing I struggle with. I struggle with getting good night's sleep, so I have to. Always talking about it and really working at what do I need to. Did I get a good sleep last night? No. Oh, I slept better tonight. And I mean, when you get a real good night's sleep, it's like
Yes.
so. Sleep is something that I'm really working through and struggling with.
Since we're rooted in the church and since the Balm and Gilead is rooted in faith, I think a lot of times we talk about the physical health. How do you keep yourself spiritually healthy? Ah,
Well, that's an easy one. That's the
okay.
easy one because, like I said, I grew up with folks who taught me how to pray. They taught me how to hear the voice of God.
Yes.
And it is my faith, my belief,
Mm-hmm.
and I believe in the allness of God.
Yes.
That and that transcends. I share with people that I have been blessed to have traveled the world, and I love religions. I love all religions. I love the way God shows up in people's
Mm.
lives. I'm very comfortable in the mosque. I'm very comfortable in the Buddhist temple. I'm very comfortable with being in a Yoruba or Batala is one of my Oshuns. I mean, I just love the way God shows up. I chose as an adult, I chose to be Christian. You know
Mm-hmm.
what I mean? I chose Jesus as my Lord and Savior. That does not negate anybody else
Right.
because I just love the way God shows up in people's lives. I
Mm-hmm.
love, however you pray, your prayers are answered.
Yes, ma'am.
So that oneness with God. I am one with God. I am
Mm-hmm.
one with all life and one with all people. That's the faith that moves me, and that allows me to deal with those hard knocks bishops and pastors who don't want to move when I want them to move, because I know that there's a God within them and a God within me that meets each other, even though my physical don't understand what in the world you're doing or saying.
Right. Right. Any parting words that you would have, like, I'm going to ask you two ways for providers or practitioners or researchers when they're interacting with community? Any parting words or advice that you have for them?
My parting words there would be for our providers and parishioners. Your role is so critical,
Mm-hmm.
and it's critical to the point that you are the entry for someone getting health care. It is how you treat a person, whether they're going to come back or not. You know, a person may come and they finally got it together to come to the doctor, to come to the hospital,
Mm-hmm.
and whether you're the receptionist, that receptionist plays such an important part
Mm.
because it's how they treat me if I'm going to come back.
Right.
You know what I mean? So remember that everybody has, um, everybody's a child of God, and everybody has the right to have your respect and to get access to
Mm-hmm.
quality health care.
Yes.
Don't stand in the way of someone getting healthy.
And that's what I tell students when I work with them and other practitioners. A lot of times we see people in their most vulnerable state,
That's
right?
right.
If they were healthy, a lot of times they wouldn't be coming to see us.
Mhm.
And a lot of times we have the ability to really see the social drivers of health play out in real time.
Right.
So, what happens when you don't have access to, a pharmacy or a provider? And then just understanding that, we have to see the whole person,
That's right.
race, religion, all of that. None of that matters. We have to see the person as a whole. And
That's
like you
right.
said, meet people where they're at. And
Right.
I could talk to you for years, but I want to be respectful of your time. One last question. Um, what would you say to community members as they try to navigate becoming spiritually, mentally, and physically healthy? What piece of advice would you have for them?
Oh, there's a balm in
Yes.
Gilead.
Yes.
There's a balm in Gilead and it heals the wounded soul. It is your responsibility. It is your responsibility to find your connect to to God within you, whether that be through a church, whether that be through your own meditation, whether that be through your walking in the park, and however you feel you need to connect with your God. I believe that um, fellowship is important. And I know that after COVID, many of us are struggling getting back to church. But I think that God created us to be in relation with one another, and fellowship is important. Being in oneness with each other. So I think that is my parting words would be to connect with people.
Mm-hmm.
Do a critical analysis on who you connected to and who you connecting with,
Yes.
because everybody you may be connected, some people you connected to may be a part of your health problems.
Mm-hmm.
You know what I mean?
Right.
We have to, I'm learning that in my beautiful latter days, that some of my friends I have to shift because they're not I'm not in right fellowship with them
Mm-hmm.
anymore. Nothing wrong with them, nothing's wrong with me, but we're moving in different ways. Not a good thing or a bad thing. It's just a journey of life,
Mm-hmm.
but I think that being in right fellowship with one another is critical. Knowing, having a relationship with God, whether it's through Jesus or Muhammad or however, it's important. Taking that walk, taking that walk, or that spiritual bath, if you will.
Yes.
Having family time, and family could be good or bad, Lord have mercy.
Yes.
But having connecting, because we have, I remember my mom and them used to say we living in troubled times. Well,
Mm-hmm.
like we've always been living in troubled times. There ain't nothing new about these times. We're living in troubled times, but I'm learning as I grow older that as we grow through these troubled times, it's very important that we connect with family, we connect with friends, we connect with like minded individuals, and we drink our water
Yes.
and be conscious of our health. Do not ignore the fact that your knee is hurting you today. You know what I mean? Or
Mhm.
your there's a ringing in your ear, or your eye is just burning you today. Do not ignore those little things. They might not be just the body just reacting to something, but it might be something. Pay attention to your mind, your body, and your soul, your spirit.
Well, thank you so much, Dr. Seal. It's been an honor and privilege to be here. I am Dr. Ronda Marie Chakolis, and this has been For Your Health. Thank you.
Thank you.